Hello everyone, this is Group 6 and we are representing Turner's family. Turner's family include 5 members. Victor, the father, 49 years old. Bettina, the mother, 46 years old. Nikolai, 20 years old, which is the oldest son. Peter, 40 years old, and the youngest kid, Levi, 4 years old. The Turner's family is a well-to-do family. They live in an expensive neighborhood with high security, and they are from a Jewish descent and practicing Judaism. The father, Victor, he was an accountant for 20 years with high-paying job in a prestigious company. The company provided him a full family health coverage insurance. And he had a hypertension and he used hypertensive medication for so long, and his hypertension was very well controlled with medication. He also believes in healthy living and lifestyle, and he engaged in sports like golfing and other sport activities. Since the company went bankrupt, he lost his job and he became unemployed. He tried looking for a job, but his qualification was overqualified for him, and he didn't want to downgrade himself to a lower position job. So since that, he became depressed. The mother, Bettina, she was graduated as a teacher, but she didn't work since she got married and focused on raising children. They thought it would be a wiser solution for the family to just raising the children. However, since the husband lost his job, she decided to get back to working as a teacher, but the Ontario College of Teachers told her that she is unable to, and she needs to have some courses and studies, so she is unable to return to practice as a teacher. She also has a family history of diabetes, and recently she is manifesting some symptoms due to diabetes, like hunger and thirst. So she's also worried about the signs, and also she's very anxious and become very sensitive because she's worried about her children's future. Nikolai, the oldest son, which is 20 years old, as I said, he's a student in university studying architecture. Since the family crisis, he decided to work as a part-time job, but it wasn't sufficient financially for him and the family. So he decided to quit school and work as a full-time job, so he can compensate some financial problems of the family. He also became very isolated and become very introvert and doesn't want to hang out with his friends anymore. The middle child, Peter, which is in intermediate school, he has a history of severe allergic reaction and asthma. He had an asthma attack 2 weeks ago in a school, which led him to come back home, and the school asked the mother to buy EpiPen for him again. But because financially the family is in crisis, the mother is unable to purchase the EpiPen for the kid. The Peter is also supposed to be a part of the Quiz Bee competition, and he participated in some preparation for that, but since the crisis began, he wasn't unable to concentrate on preparation, and he also decided not to participate in any competition at the school. The youngest son, Levi, he is in preschool, but he is developmentally retarded. He also has been diagnosed with autism 2 months ago. He has some behavioral manifestation like aggression, lack of concentration. So he completely has these kind of problems, and he is just able to speak 50 words. So with a handful of these problems that family is struggling with, the mother came to the clinic and asking the health professionals to helping the family to getting back on their feet. And she is also worried about her husband because he is not doing any sport activities anymore, and he's always talking to himself and become very anxious and a bit aggressive towards the family. And also the family is unable to sustain the insurance anymore due to financial problem. They also sold the 2 cars of the family, and they are decide to sell the house. And also they haven't had any medication since the crisis. Even though with all the problems that the family is struggling with, they have some commendations. First thing is that Bettina is a very strong woman, and she's fully committed to the family. She went and asked help from the health professionals, and she's worried about her children. Victor, the father, is highly educated and he's capable of finding a job, and because he is not using alcohol or any drug abusing, he's completely unable to get back on his feet. Nikolai, the oldest son, is very helpful. He is decided to be a man in the family and trying to find a job to help the family as the oldest kid. The family is very resilient to changes. They were very flexible and they didn't leave the family. They stayed together and they try to become very wise about all the changes that happen to the family. And also, they know how to deal with distressful situations in the family. They have their backs and they try to be together and helping the family to get back to normal. Thank you.
Are known to be good communicators and have good manners. These are by introducing themselves, referring the client, not labeling or stereotyping them, participating the whole family members in procedures and steps to reach goals, making eye contact, checking the attitude, explaining their role, always keeping promises, always being on time, and always being honest. There are certain therapeutic questions to be asked to the Turner family, which are, how can we be most helpful to you and to your family? Second one is, who do you think is suffering the most in your family in this current situation? The third one, what is the one question you would like to be answered now? What have you done to work on the concerns so far? What is the perception of each family member on the other member's reaction to the current situation? Is there any relative or friend that can help you in this situation? Thus, all the member of the family ready for changes and help. This will give the nurse a picture on the coping skills of each member and on the strengths of the boundaries of the family and between each member of the family. It also helps the family to critically rethink their ways to cope with the current situation. We were able to use tools that have been useful for the assessment, which are the first family assessment and intervention model and family system stressor strength inventory, or the FS3I. This helps in problem identification, family strengths identification, and general and specific stressors recognition. So it focuses on the family's strength, which can be helpful in prevention and intervention. The second one would be family genogram and the family echo map. The family genogram provides information for planning intervention strategies, and it is helpful for both healthcare provider and family to see a whole picture of the family in 3 generations and a quick overview of the complex condition and the impact of health issues on family function and structure and processes. On the other hand, Echo Map is used to show a clear picture of the connection between the family unit and the community around it that are the supporters and the stressors to the family. It is a good way to start a discussion and ask the right questions in counseling. The third one would be the family reasoning web template. This is used to analyze family story by putting information together into meaningful categories. The categories of this family reasoning web template helps us in assigning the diagnosis to each category and connect the information for our future care plan. We were able to identify a scholarly article that is related to our case scenario. So this is the hypertension and stressors as the most prevalent risk factors in cardiovascular disease, causing impact on quality of life of hypertensive patients. It is the aim of the study to assess the vulnerability to stress of hypertension patients and identify the factors of vulnerability to stress which interfere with quality of life of hypertensive patients. So for the effect of unemployment on the family health, for the Turner family, for the parents, the increased level of stress, depression, feeling of frustration, fatigue, non-compliance to medication. On the other hand, for the children, there are two negative effects we were able to identify. These are the increased level of stress among the 3 children and social isolation for the eldest son. This is based on Santos, Chavez, Andre, and Duarte writing.
Hi, I'm Sheija and I'm going to present about the Turner's Family Care Plan. The priorities are grieving related to the loss of job as evidenced by depression. The second one is altered family process related to lack of understanding and communication skills. The third is stress related to loss of job. And fourth is the risk of self-injury related to altered thought process due to depression. These are the interventions. Enhance therapeutic relationship. Encourage client to talk and to ask questions. Listen to family and be aware of the feelings and values. Empower the family. Emphasize on family strength. Collaborate with the family in identifying the resources and their strength, and encourage members to improve communication. Encourage and assist family members in identifying coping strategies. It might help minimize the negative effects on the family. Assist family members to determine realistic goals and the ways of reaching these aims. Provide support through supportive program, community program, referrals, and communicate with other interprofessional team. It's very important to assess the grieving related to job loss, and in the Turner family, the causes of the grieving are loss of job, inadequate coping skill, lack of social support, and possible financial burden. Assess the cause. Ensure that the basic human needs are met. Provide an atmosphere of care by ensuring privacy and professional intimacy. Be available and non-judgmental. Perform actions to promote trust by answering upcoming questions honestly. Supply requested information. Encourage each member to verbally express anger, fear, and sadness about the current job. And the altered family process is the nurse should encourage and assist family members to verbalize emotions about their family structure, roles, thoughts, and in general their life. The nurse needs to use active listening as a communication tool and maintain a non-judgmental attitude about the feelings shared. The nurse might also assist family members in realistic and honest perspective, conveying as much as hope as appropriate. The nurse needs to determine the stress factors and how to apply an adequate stress management. Each member needs an individual assessment on stress and what strategy would be the most helpful way to release tension. Some people might use yoga or meditation, others like to hike or use sport in general to release stress. Lack of communication, knowledge, unresolved issues, and misunderstanding raise the level of stress and needs to be addressed. It may help the family to spend more quality time together, actively participate in recreational activities. It helps to strengthen their relationship. Recreational and relaxation technique helps to elevate stress, depression, and anxiety. And the last is to encourage Victor, the father, to identify and use available support system, provide information about available community resources that can help him to exchange valuable information and avoid staying idle and focus on resiliency. Community support is beneficial in helping to meet unresolved needs, decreasing feeling of low esteem due to loss of job, and facilitating positive self-image.